Dr. Patricia Hayes with Partners in Primary Care says they focus on the obvious and not so obvious needs of seniors in particular. Everything from the types of floors in the office to extra time. Patients really appreciate the Platinum service in their golden years.
I was in pain for 10 years. The work that I do, you kind of put a lot of strain on your back and your hips. The doctors that I went to were always saying, I've reached that age where you're going to have to learn to live with this. I ended up going to Partners in Primary Care and meeting the doctor. This guy was focused on me. He was interested in what I wanted to do in life. And I said, wow, this guy really is on my team. It was like going to a different planet.
Dr. Hayes, there's a lot to be said for that term partners in primary care, because that's what you really want, is for seniors to be partners with you.
Absolutely. Our main focus here is putting the patient at the center of the care and really making sure that we are following through with what their preferences are, what their family members feel like is the best for them and what they feel like is the best for themselves. So it's not about us telling patients what to do. It's about us partnering with them and determining what's best in the context of where they are in their life and their health journey.
And, we hear all the time about the pediatrician, doctors who deal with children, but when you're dealing with seniors, there are some different concerns as well. And one of those is that they like for their doctor to stop and listen to what they're saying. And so you build room in there for that to happen.
Actually, one of the aspects that drew me to Partners in Primary Care, and which I think is so amazing and really sets us apart from other primary care practices, is that extended length of visit that we allow for our patients. So 40, 60 minutes to spend time with, your physician or our nurse practitioners is really changing the healthcare environment and transforming the way we deliver care. People want to be heard. They want to have time to, talk about every issue that they may be facing, and also just have time to get to know each other on a personal basis and get to know, again, getting back to those preferences and desires and things that really make people tick. I can give you a medication, I can tell you what to do, but if I don't know that that's actually going to work for your lifestyle or your health plan, then you're really unlikely to do that. Also having care team members that help extend those visits, so you get extra time with pharmacists, nurses, behavioral health specialists that also kind of extend our care that we offer within the clinic walls.
And I would imagine that it helps you to even diagnose better. Somebody may come in for something that's more visible, but when you find that you have time with them, you might find that there may be some emotional, some psychological issues that they're dealing with as well. We certainly know that mental health can certainly impact your ability to heal better or take care of any other issues.
It's an entire whole person view on medicine. We're recognizing more and more that, again, it's not just about your diabetes. It's about how your diabetes, as you mentioned, affects your emotional health, how you are coping with that at home. Do you have people at home to help you manage your diabetes? Do you have the resources to help you manage things like diabetes? So, in addition to having behavioral health specialists that help with coping and help with, understanding disease and how it affects you emotionally, we have other members of the care team like pharmacists and social services that also delve into the other aspects that help us manage our care, like prescription assistance and understanding our medications and prescriptions and just helping get resources that support us at home and away from the clinic.
You also have virtual programming, which might be a little new to a lot of seniors.
I think COVID-19 has really made us all have to kind of rethink the way we deliver healthcare, which I think has actually been a blessing in disguise. It's hard for some people to get to the centers, and some people also have safety concerns, which we're doing everything in our power and under recommendations that, keep our facilities safe, clean, and decrease the likelihood of transmission to almost nothing. But for those people who still can't make it in or don't feel comfortable, we have virtual programming, not only for clinical visits with your physicians or members of the care team, but also virtual activities that can be done, through our activity centers. We normally have programming from, American Heart Association or, the Alzheimer's Association, but we, have not been able to do those in person over the last few months, but have converted a lot of that over to virtual programming, which is allowing our seniors to, continue to engage in social activities and not be seeing the pandemic as a barrier, because we, definitely want to decrease social isolation, which a lot of people are feeling right now.
All right. There's also a mobile discovery experience. What is involved with that?
For some of our centers that are up and coming and opening, we will have a mobile discovery experience, and that should run from October to about March. And that's an opportunity for patients to come and kind of view a replica of what our sites look like inside, view what an exam room looks like, get a feel for all of the special things that we have here that really focus towards senior care, like non-slip floors, larger exam rooms, more comfortable exam chairs and tables, things that we feel like really help support the senior visit. So when they come and visit us here in the clinic. So our mobile centers are going to be kind of dispatched throughout Houston. We're growing throughout the Houston and greater surrounding areas. So if you visit partnersinprimarycare.com or seniorfocusedhouston.com, you can actually find a list of where our mobile discovery centers are coming next.
Dr. Hayes, thanks for taking care of our seniors. I'll see you one day, not quite yet, but one day.
Absolutely. We will welcome you.
It makes me feel good about who I am and where I am in life. That's so important to me. No, I'm not 25 years old, and I'm not 30. I know what I am, but I'm a darn good 65.
For more information and to find your nearest Partners in Primary Care location, visit them online at seniorfocusedhouston.com, or you can become a new patient by calling them at 832-299-2369. That's 832-299-2369.